Welcome to this edition of Buncombe Life. I'm out here at the Reed Creek Greenway. It's beautiful. If you haven't ever been here, you need to come check it out. It's near University of North Carolina, Asheville, real close to downtown. It is beautiful. And a beautiful place to get out and get that heart working. If you've been watching us, you know we've been featuring heart health. If you've missed that video, you've really missed something that you need to see. I want you to go see it on YouTube. Check it out on our YouTube channel or on here on this channel. It'll be playing again if you've missed it. While we were filming that video, which we really enjoyed doing with our partner Mission Hospital, we came across something, an innovation that they're it's amazing how they got to do that and bring that here to us. And we're going to tell you about that today. It's an innovation for something that happens to the heart. We learned it was actually one of the #1 problems with the heart in the aortic valve. Don't know what that is? Stay tuned because we're going to tell you. What they do, it's called the TAVR procedure, and I have to look at my notes because it's complicated and I've got to cheat here. Transcatheter aortic valve replacement, or the TAVR procedure. Why is that important? Well, come to find out, disease of the aortic valve is one of the #1 problems with the heart. And if you live here in Asheville, you're very fortunate. If you'll stay tuned, we'll tell you why. We're going to jump right in today. We're going to jump right in with Dana Triplett, Mission Heart Valve Clinic Coordinator, and she's going to give us a little anatomy lesson, and she's going to show you, first of all, where the valve is, and then a little bit about the procedure. So stay tuned.
Okay, just a small anatomy lesson.
Yeah.
In your heart, you have 4 different valves. The valves separate the ventricles and the aorta, and that allows the blood to flow in segments through the heart and to the rest of the body. One of the valves is called your aortic valve, and it sits in between your left ventricle, which is the main pump of the heart, and your aorta that feeds the rest of your body blood flow. So the problem exists with this valve. Over time, it becomes very calcified, and that calcium prevents that valve from opening and closing as it normally should. So it's kind of like a clogged water hose. So what happens is, since the blood cannot go through effectively, this part of the heart has to overwork or compensate for that. So this part of the heart gets big and bulky. The other effect is you have minimal blood flow coming through. So that's when your symptoms come about from severe aortic stenosis. You may have chest pain, you may have syncope or lightheadedness. The other thing that you may have is shortness of breath. And some of those things can often be masked by other things like pulmonary disease and so forth.
Right, and this is just one of the things that some people could go to their doctor and say, I have these symptoms, thinking it's just symptoms of maybe a coming heart attack, when actually this is the issue.
It may be the valve. And oftentimes how a physician may know that you have a valve problem is you'll often hear a murmur or a sound. So if your physician has told you that you have a murmur, then more than likely it may be one of your valves is not working appropriately, and oftentimes an echocardiogram is something that you'd need to have to see what valve is actually the issue.
So if you come to Mission, to your cardiologist, and they send you here, you guys can address this.
That's right.
With the procedure. Now tell us about how this is a new procedure.
It is. In November of 2011, the FDA approved a new treatment for severe aortic valve disease, and that is called a TAVR, transcatheter aortic valve replacement. And so basically what this is, it's for patients who have been deemed inoperable. They have a lot of comorbidities and wouldn't normally make it through a traditional open procedure to get their valve replaced.
Right. And there's one thing you've said, and I want you to define it, comorbidities.
Comorbidities is anything besides the heart that plays a role in the overall health. Again, this could be a significant lung disease, such as COPD. This could be renal disease if they're in some sort of renal insufficiency or failure. This could be diabetes, anything that makes them a higher risk patient.
Right.
That's
Symptoms
what
outside the heart.
Outside the heart that play a role in your overall health. This procedure takes a catheter through their artery in their leg and feeds it up through the heart through the aorta, and they replace the valve with what seems like a cardiac stent. It's a mesh metal wire that replaces the native valve, and it's the same type of tissue that they use in a traditional open replacement.
The stent. It's the same tissue as a stent, and we were talking earlier, we said it's chicken wire.
It looks like chicken wire.
Yeah, and it just opens that up.
It opens that up. It actually replaces the native valve. It pushes the native valve against the walls, and it replaces that.
Yeah.
So for patients who couldn't tolerate having their chest open, who couldn't tolerate being on a bypass or a heart-lung bypass, the stays are shorter in the hospital. The recovery time, you have a small incision in your groin compared to an open incision on your chest.
Wow, yeah.
So there are a lot of benefits for those that are high risk or inoperable to have this procedure done.
And this could really buy them years of life.
It can, and it can buy them quality.
Now, and you guys here at Mission are doing that procedure.
We are. We are one of 5 hospitals in North Carolina, and we are the only hospital in Western North Carolina to offer this procedure to our patients. So we're happy to do that because it keeps patients close to their families and their support systems, and we can, check up on these patients and make sure they're getting the care that they need.
Yeah, and it's a solution for some people who really they were
There
to
was
the
not
end.
a solution, that's right. Yeah. The procedures have gone well, and our team is excited. And that's the biggest part of this concept. Here at the Valve Clinic, it is a collaborative team effort. So we have a cardiothoracic surgeon, we have interventional cardiologists, we have echo physicians, numerous team members that come and take a look at each patient's case to make sure this is exactly what they need.
That is so exciting. Again, just another one of those innovations that it makes me so happy to live here. So I know if I have any of these issues that there is a solution, and you guys are always looking for those solutions.
Yes, yes we are. And another thing about the clinic is we have a nurse navigator. A lot of times when patients have a lot of comorbidities, they go to the doctor often, they have, they're tired of that process. And so what we have is a nurse navigator that educates the family and the patient, helps set up those appointments, obtain the medical records, and really just walks them through the process, which is just immeasurable how much help that is.
Because this is a big decision to do this kind of procedure, and to hear, I don't have a choice.
Right.
That's scary. So that's an awesome piece of this whole thing too.
Just a supportive, patient advocate role that we can provide patients and their families. That's correct. And the FDA has just approved for high-risk patients as well as a different option. So for patients that do not have a doorway or their arteries are not large enough to accept that catheter, they are coming up with different ways to deploy that instead of opening the chest.
So we'll even get better.
Technology is just amazing.
Yeah.
So here at Mission, we just want to be on the forefront so that we can offer these options to patients.
That is so awesome. Thank you.
You're welcome.
I hope you enjoyed that. Wasn't she great? We so enjoyed her explaining that to us, but it gets even better. You don't want to miss this. Dr. Josh Leitner was so wonderful. We sat down with him and he walked us through this whole procedure, and I have to say, if I was confused at all after talking with Dana, after I talked with him, I understood it. You've got to see it, and he's next.
Hi, I'm Josh Leitner. I'm a physician. I've recently joined Asheville Cardiology Associates and Mission Hospital, and I'm going to talk today a little bit about some of the recent advances in cardiac care that we're able to offer here at Mission Hospital. The procedure I'm going to focus on today is a procedure we call TAVR. That's T-A-V-R, and it stands for Transcutaneous Aortic Valve Replacement. This represents a really important advance in care in the recent past in cardiology. The disease that it's designed to treat is called aortic stenosis, and it typically affects older adults. Traditionally, this treatment has required open heart surgery. The process that happens is over time, the aortic valve, which is the last heart valve that the blood has to pass through before exiting the heart to go to the body, this aortic valve becomes stiff and calcified. And it requires the heart to generate a much higher pressure to open these rusty gates, so to speak. As a result, the heart suffers from having to generate this extra pressure for such a long period of time. Traditionally, this has required open heart surgery and a surgical valve replacement. And because this disease happens in older adults, many of them are not candidates for this open heart procedure. The procedure of the transcutaneous aortic valve replacement, and transcutaneous just means through the skin, meaning a change from a standard surgical approach of an open heart surgery to a catheter-based approach, which is an incision in the skin. Basically, the procedure works one of two ways. The main way it's traditionally been done is like a heart catheterization. An incision is made in the arteries that feed the leg muscle, the so-called femoral arteries down in the groin region. And with needle sticks and a small surgical incision, they're able to pass a catheter, which means a plastic hollow tube, and they're able to advance this catheter backwards up the arteries of the body, up into the aortic valve. The heart is rapidly paced, meaning it's run very fast, to allow us to have the control to position the valve. The valve gets placed inside of the native valves, meaning the valves that you were born with, and gets expanded on a balloon. This ends up putting the native valves, or the valves you're born with, up against the wall, and the new valve, which is the same as a surgical valve, will then continue to function normally. Typically speaking, patients will be off the breathing machine later that day or the next day, and will be walking around as soon as a day or two. The recovery time is considerably less than open heart surgery, and that's part of the reason we're allowed to offer it, or able to offer it, to so many more patients. Those who are at very high risk for surgery, who would not otherwise get treatments, and even those who had traditionally been excluded from surgical therapy in the past. Recently, this therapy was evaluated in a clinical trial and showed one of the most important improvements in survival of just about any therapy we have in cardiovascular disease. So it's really been a blockbuster breakthrough, and it's something that the cardiology community has been extremely excited about. About a year ago, this technology was offered on a commercial basis, having passed through the FDA approval process after this blockbuster clinical trial. At this point, every hospital in the country wanted to be a part of this. Many were evaluated, few were chosen. Mission was one of the first ways to do this, and this was based in part on their excellent tradition of surgical care and their excellent tradition of cardiovascular care that they've been able to provide to this community for a period of time. So they're very excited, and the hospital has really stepped up and dedicated a lot of resources to building this program. We've recently built a brand new hybrid operating room, which allows a multidisciplinary approach, meaning physicians who are interventional cardiologists, such as myself, and heart surgeons, and echocardiographers, and a whole team approach to work together in a state-of-the-art room with state-of-the-art equipment, allowing us to do the kind of procedures in a very, very sophisticated way. Additionally, they've built a brand new heart clinic, and they're currently constructing a whole new process to allow the patient flow to run through extremely smoothly. So the hospital has really been behind this, and the team of cardiologists that I'm very happy to join, and cardiac surgeons, and all of the care providers here are really top-notch. It's part of the reason why I came here.
Now, if that wasn't interesting, and to think that Mission is one of the only places around the whole United States, one of the few, that can actually do that procedure. We were so intrigued. They actually found us someone who has had the procedure, and that's where we're going next. We went out and San, that's her name, invited us into her home. She had a wonderful home, beautiful place, to come in and meet her. She actually had the valve. She has it in her. You'll see, you'll hear from her. And it was just a wonderful experience. So stay tuned and listen as we go meet San. Well, I'm here with San, and you said Shirley Ann, and they call you San.
Yes.
Woodbridge?
Woodbridge.
Woodbridge. And she is a patient, as you've heard me say before, from Mission's TAVR Project. And we just wanted to talk to you because to know somebody who's actually had this procedure done that we've seen done, we've showed the folks at home how it's done, but you've had it done. I want you to tell me about that. How did that, first of all, let's talk about why you needed it.
Well, I guess my heart was only functioning about 25%. And so they told me I just had so long to live, you know. And but then this project came along, and they thought that I was a good candidate for that, because I didn't have any other problems except that I couldn't live very long.
Yeah, yeah. Except that valve just wasn't
wasn't
doing
working
it
too well.
Yeah.
So, but I was fascinated with the project because Dr. Abernathy had to do it earlier, the day before, and he told me what he was going to do. So he came up, and I could see this on the.
So you were awake during the procedure?
Yes. Well, just his initial procedure.
Okay.
We didn't get into the heart, but I was fascinated being an X-ray technician.
Yeah.
I could see through the films on the project how that vein gets that little catheter going up through this little vein, and in the middle of it, it turned around and made sort of a snake drive, and I thought, now how is he going to get that out? He did. I don't know.
Yeah.
I didn't know the veins would wiggle around like that.
That's amazing.
Yeah.
Now, before you had it done, what were your symptoms? Were you like tired, or how did you know you needed it?
Well, I didn't know that I needed it, but I was very slow and breathless sometimes, you know, and that's the only thing I knew. I didn't have any other problems.
Okay, so then you went in and they said you were a candidate for it, and they did the procedure.
Yeah.
Well, now, how was the recovery?
Oh, it was very good. I mean, there wasn't anything really recovery.
Really?
I had to recover really from another surgery that they did the next day because they had found these kidney stones. And they said, you've got to get those right out.
Oh, that was probably worse.
Yes, that was much worse.
I bet. That was a lot worse.
Yeah.
So they just went in, replaced the valve?
Yeah.
Could you feel it? Could you tell any difference?
No.
Your heart just kept going? You couldn't tell that little thing is in there, that little heart thing?
No pain, no nothing.
Wow.
And so it was a very easy procedure.
Wow, that's really good.
Yeah.
Well, now, have you felt more, have you felt
well,
better?
I feel that my heart is much better in that whatever I do, I'm not all exhausted and this sort of thing.
Yeah.
Yeah.
Well, my last question here wanted to be is if you were talking to somebody who was a possible candidate for this procedure, would you tell them to do it?
Oh, yes, definitely.
Yeah.
Yeah.
You'd say go
it's
for it.
It's very easy procedure, really. Those doctors figuring this out, that they could go through these veins, which they started here in my groin, all the way up, you know, climbing up to the heart.
Yeah. And then going in there and fixing it and coming back out.
Yeah. I never could figure out how they got in the heart, you see. That's the part I'd like to know. Well, I suppose through that vein.
Yeah, that is awesome. Well, thank you for talking to us.
Well, I enjoyed doing it. I hope somebody else has this done.
Oh, I think so.
Because it's really very easy, and it's very relief, too. You don't have problems at all with it.
To know that's all fixed. Yeah. Wasn't that great? We just had to share that with you. We were so impressed when we did the heart video with Mission, and then they showed us this procedure. We just had to share this with you because, once again, the reason we do Buncombe Life is so that you'll be proud of the community you live in. I was just very interested that the most common heart disease is around that valve, and so reassured to hear that Mission is one of the few hospitals that has the TAVR procedure, and it's right here in our backyard. Again, wonderful reason to live here, be proud of where you live, and be proud of our partner with Mission Hospital. Again, you got to stay tuned next month because you never know where we'll be, but you'll need to be with us. Stay tuned.